Foothills AHEC helps advanced practice health profession students during community-based training by offering clinical placement assistance, housing support, and travel support. We offer this support to students at no cost to them to facilitate training opportunities within the 31 Northeast Georgia counties we serve, particularly those medically underserved rural and urban communities. This support is paid for by Foothills AHEC and our community partners and is in no way funded by tuition dollars. We work with a variety of academic institutions to meet the clinical training needs of their students by finding prospective preceptors in our region. We also make sure to educate them on the benefits of the Georgia Preceptor Tax Incentive Program, better known as PTIP, which allows physicians, PAs, and nurse practitioners the chance to earn state tax credits for providing rotations.
My name is Lee Church. I'm a family physician in Hiawassee, Georgia. What do I like about being a preceptor? We may not have enough time to talk about all that. They make my practice of medicine better. I enjoy them. It is a daily goal of mine to learn something new from a student every day. That's one thing. And also, they're part of my team as well. So when I talk to the patients, I say, they turn over some stones that perhaps I might, in my older age, may have not turned over. So just watching some of those relationships that the students have with my patients, that is also just an enhancement of the care, and it just wouldn't happen otherwise.
Well, my name is James Cutts, and I'm a PA student here at Bernard University. My first rotation was up in Blairsville at Union General Hospital. I was in the ER. I grew up in a rural town, so I know what it's like to actually have to travel somewhere to get medical care. These rotations that I've been on in the rural areas have really solidified what I want to do, because I understand where our patients are coming from. I understand the difficulties it can be sometimes to get certain type of treatments, and we have to send them off different areas. So I do understand the frustration that patients go through sometimes. And I feel like we as healthcare providers can really kind of mitigate that and really help them navigate that system.
So I'm so thankful that I landed here. It was a bit by accident, but I knew there were some features of the rural area that had attracted me. But then I didn't want to keep that to myself, and the community continues to be in need, as other rural communities are. And I started taking on students with the hopes of them experiencing that. And we now have housing here to really make it very easy for them to land here for their training experiences. And it turns out about half of the students that come through here are choosing family medicine and primary care for their specialty. Of course, they go off different parts of the country for their training as well. But so I feel like I'm contributing to that. They have certainly fallen for this really wonderful way to practice medicine in the rural community.
My name is Leslie Prevost, and I'm the Student Support Coordinator at Foothills AHEC. My role is to coordinate housing, travel support for healthcare professionals rotating in our region. I also work in tandem with Northeast Georgia Health System to onboard and credential students that are rotating at the hospital. We're in Northeast Georgia, so we have housing in Athens, in Augusta, down in Augusta. We have housing in Demarest, 2 housing sites in Demarest. We have housing here in Gainesville, in Lawrenceville, and in Hiawassee. One of my favorite aspects of my role is being able to provide support to our healthcare professionals, either by reserving them safe and comfortable housing during their rotations, or by providing travel support.
Actually, our professors here at Bernard University, they recommended AHEC housing for us because they knew that it was going to be a little challenge sometimes, to find housing near your rotations, and they would be sending us, anywhere from a 100-mile radius away from the school. It's the difference between surviving a rotation and thriving in a rotation. When you have to worry about where you're going to live for a rotation that's miles and miles away from your actual home, it can be very stressful. And so having that as an option and having that ability to stay somewhere like that in the AHEC housing really takes a lot of stress off of you. And that way you can actually really focus on your rotation and focus on going into work and not having to drive for hours. So I really like that.
I enjoy saying yes to students by giving them things like no cost housing. I know that's a very big help for them because they're in unpaid internships, basically is what clinical rotations are. And so to be able to provide help, it really aligns with my personal values.
I would strongly encourage folks to take the plunge for teaching. It's not as, there are a lot of folks who are a little scared to do that because they think, well, what if they know some things that I don't, I haven't kept up with certain things. There are so many resources to help you be an effective teacher, and you have a chance to do it even better than what you experienced, and it is just so fulfilling personally, and a good way to grow as a physician. It can help keep you sharp and will challenge you